What if someone told you that you couldn't go home tonight? You were really sick and you had to go to the hospital right away. So you would go to the hospital and there's all kinds of crazy sounds and noises and people that you don't know. And they put you in a room by yourself, away from your loved ones. Our healthcare environments can breed anxiety, depression, loneliness, and even increase pain levels. All of these things can adversely affect patient outcomes. But what happens if we bring art into the hospital? I met Archie on day 43 of a hospital stay to treat his leukemia. He was feeling really down that day, but we brought some symphony musicians with us, and he loved it. And he confided in me that it was his dream to sing "O Holy Night" with the symphony. And so we made some magic happen.
I have seen the arts impact patient experience immensely. Art and music activate certain parts of the brain that medicine doesn't. It has a proven physiological effect on us. It lowers heart rate, it lowers blood pressure, it decreases patients' perception of pain, and makes for a more holistic kind of treatment. We're treating the whole person.
So when you guys come in, it just lifts my spirits. I'm so appreciative that there's programs like this.
But our program isn't just for patients, it's also for healthcare workers. This is critically important, especially in the aftermath of COVID-19. The weight of burnout and PTSD weighs so heavy on our healthcare workers that almost half of them are considering leaving the field in the next 3 years. If something isn't done, our healthcare systems could collapse.
Just last week, we had a staff member that came into our office and shared how much anxiety she receives coming in as she's driving into the office to care for our patients. The few projects that we have done with Hearts Need Art, we have seen a significant impact on our staff and their employee well-being.
I'm doing good now.
Did you like the music?
Yes, thank you so much. So much. Awesome.
I always wanted to be a full-time musician, and what Hearts Need Art has given me is the opportunity to do that and to say, I'm going to help people through music.
With a grant from Impact SA, we'll be able to provide 5 days a week of programming for 45 weeks at Northeast Methodist Hospital. This is a 230-bed hospital with almost 1,000 staff and serves tens of thousands of patients every year. The data we collect to measure the impact on patients, caregivers, and key hospital metrics could lead to further investment in the arts and healthcare throughout the region.
Healthcare is a data-driven industry, and we're all about evidence-based practice. And that's what's so exciting about this project, because I've seen it with my own 2 eyes, and I'm very excited to be able to put the numbers together to demonstrate it to the folks that might need a little extra encouragement.
So to hear music moves me inside. But this will be the first Christmas I'm away from my children. And this is, to hear music like that moves your soul, moves your heart.
With your support, we can create meaning out of chaos, hope from pain, and we can help our healthcare workers return to joy.
I'm with Jose Contreras, and he wrote a beautiful poem for his son in Spanish, and he asked if we could put it to music, and so we did that this afternoon.
Al Señor Dios de los cielos, yo le pido este milagro. Para ti no hay imposibles, nada más, en ti confiamos, mándale el alivio a mi hijo, de rodillas te imploramos.